Welcome to Tell Our Stories. Today's episode brings together personal experience, public advocacy, and provider leadership in a way that few conversations can. Our guest today is Zach Shamberg, Chief of Government Affairs at Saber Healthcare and a longtime advocate for seniors and caregivers. Zach joins us with a unique vantage point. As a grandson of a loved one living with dementia, as a former statewide advocate for long-term care providers, and now as a national policy leader at one of the country's largest long-term care organizations. I really enjoyed our conversation today, and I think you will too. This is the Tell Our Stories podcast. I'm Ryan McNamara, and I'm joined today by Zach Shamberg from Saber Healthcare. He's their Chief Government Affairs Officer, so thanks so much, Zach, for joining us today. We're really glad to have you here. Could you please just start by telling our audience a little bit about you and your role at Saber?
Sure. Well, again, I'm Zach Shamberg. I'm the Chief of Government Affairs for Saber Healthcare Group. We're a long-term care provider with 143 nursing homes in 6 states. So that's Ohio, Pennsylvania, Virginia, North Carolina, Indiana, and Delaware. And I'm fairly new to the role. For the previous 6 years, actually for the previous 10 years, I was with the Pennsylvania Healthcare Association based in Harrisburg, Pennsylvania. So for 5 years, I was our Director of Government Affairs and our Chief Lobbyist. And then from 2019 until towards the end of 2025, I was our president and CEO. And I made the jump to this side of the advocacy table to join Saber, which is based in Cleveland, Ohio. I've been thrilled. These last 4 months have been a whirlwind, as you can probably imagine. A lot to learn about the different states that we operate in. Yeah. But I've been in politics, Pennsylvania politics specifically, since 2010. So for about the last 16 years, I have been really involved in campaigns, in lobbying, in advocacy, and working on behalf of seniors in long-term care.
Great. So has that entire experience for you been in long-term care exclusively on the policy side, or has that been a broader healthcare policy focus, or it's been largely long-term care focused?
Yeah, it's a great question. So when I was in college, my senior year of college, I went to work as a campaign intern for then Congressman Pat Toomey in Allentown, Pennsylvania, and he was running for the U.S. Senate. I fell in love with politics right then and there. And when I graduated college in 2010, I went to be a campaign manager for someone who was running for state representative right outside of King of Prussia in southeast Pennsylvania. And we won that race, and I went on to be his chief of staff. And for 2 years, I was the chief of staff. Then I was the campaign.
Winning your first race.
I won the first race, and then we won the second race. So I'm technically 2-0.
Undefeated.
For anybody counting at home. And so for the first 3 years or so of my political career, it had nothing to do with long-term care. It was all about constituent work. It was all about representing our district. It was all about being in Harrisburg. And then in 2014, I went to work for PHCA as our Director of Government Affairs and really fell in love with the work that we do and who we advocate for.
That's great. I think so much of what we try to do at Tell Our Stories is get to the crux of why folks should and want to work in senior care, right? Yeah. This is a profession that we need to attract more folks to, whether it's young frontline caregivers or folks who are advocates like you and me. So could you just share a little bit about your story of your own grandfather, which really touched my heart when we shared it on Tell Our Stories a few years ago, and really your ethos for working in long-term care?
Yeah, I remember when you first reached out about that and you asked folks in our industry and in our space to tell your story. And I felt compelled to do so and share mine. And before I talk about my grandfather, I would just say, one of the reasons that I went to the Pennsylvania Healthcare Association, one of the reasons that role was so attractive is that my parents had worked in long-term care for years. Oh, wow. So my mom was with Genesis Healthcare. She was a nurse. My aunt was with Genesis Healthcare. She was a nurse. My stepfather worked for Genesis Healthcare for 30 years. So I can remember a lot of nights, sitting at the dinner table talking about the very same issues that we're still talking about today, right? That we're still working to fix. So I was passionate about it before my grandfather ever really needed long-term care. But in 2010, he was diagnosed with dementia. And we were told that there would be a steady decline year over year. And we did our best to try to keep him at home, obviously, with my grandmother. Sure. But there were days when he would leave the house and he would get lost. There were days when he would leave the stove on. And it got to the point where we couldn't safely care for him at home. And we had to make a very difficult decision. Even my family, who had years of experience in long-term care, we had to make the very difficult decision to bring him to a skilled nursing facility. And in fact, he was in a nursing home during the pandemic. And I can remember in 2022, we were told that he had contracted COVID. And we got on a FaceTime call and said goodbye to him as a family. And that was heartbreaking for us to do, even thinking about it now. But I also remember the caregivers who were with him. I remember the administrator, and I remember the people who were so focused on making sure that he was safe. I said, and we said, everything that we do at PHCA and everything we do in the Capitol is going to be on behalf of folks like my grandfather, that we're going to fight for him. We're going to fight for residents like him, and we're going to make sure that they have the resources that they need.
That's an incredible story. I think it really gets at what is so true to anybody who works in our kind of line of work is we work on this stuff every day, right? We're supposed experts in this, and it can still be really difficult to navigate in your own personal life, having a family member who needs care and how to access that care, finding the best suitable placement for them, having conversations with them about their care needs, and especially if they have memory issues. And I've had the same issue in my family. And so I totally hear everything you're saying about that, and it resonates deeply with me.
And I would just add, I mean, we're starting to see that more and more and more. I mean, there has been study after study that is showing not only is our population aging, not only is that aging population growing, especially with the baby boomers, but more and more there's going to be a need, especially for folks with Alzheimer's and dementia, and these specialized cases that we're going to need to be able to handle and we're going to need to be able to take care of. And in no way, and it goes to the point about advocacy, in no way are we ready for that. We're not ready for it in Pennsylvania, Ohio, Virginia, North Carolina, any of Saber states or across the country. And it's one of the things that I'm so glad to be here in Washington, D.C. It's one of the things that we're telling lawmakers in Congress, that we need support now to support our seniors for years to come.
Absolutely. I think the demographics that we always mention at Tell Our Stories are just daunting. 10,000 folks a day turning 65. And by the time that folks get to 80 years of age, their care needs increase a lot. We're seeing longer lifespans result in longer care needs. When they are, entering communities of care, they're having more acute healthcare needs as well. And so in that same vein, what are some of the best solutions you're hearing or socializing up on the Hill from a workforce standpoint? I know this is something that our, other folks in our line of work as lobbyists are working on day in and day out, but what are the best sort of workforce solutions or some of the, top of mind solutions that you're using in your discussions with lawmakers, and how is that being received, whether it's at the state level or the federal level?
Well, yeah, I mean, so you bring up a great point that, again, when we look at our aging demographics, we also know that there is not the workforce to support them. And we saw that during the pandemic. I'm reminded of a study that was done nationally in 2022 of nurses across the country. And at that time, 1 in 4 nurses reported back to the survey that they would be leaving the field within the next 5 years.
Wow.
for a number of different reasons. And at that time, the median age of a nurse was 46 years old. So bordering on some sort of retirement or stepping back or stepping away. So we've got to grow our workforce. I'm a big believer in if we don't have the number of people available in this country, we've got to look outside of this country. And I may get in trouble for saying it, but we've got—
Not here. You won't be in trouble here.
We've got to focus on immigration reform. We can call it whatever we want, but there's got to be something that we can do where we can pull from other countries. We're seeing it right now. When I was with the Pennsylvania Healthcare Association, a number of our providers were pulling from the Philippines and other countries. The problem is it's extremely expensive, and the wait time is around 2 to 3 years if they come at all. There are thousands of H-1B visas that go unused every year. Why aren't we using those? There's legislation to do that. Why are we not prioritizing this part of our workforce to say, if you want to come to this country and if you want to work in long-term care, we're going to make it a more efficient process for you. We have to be doing things along those lines. I also would say we've got to be more innovative. I'm a big fan of, during the pandemic, the temporary nurse aid program that was instituted. It allowed folks to take an online training course, to go in, work as a temporary nurse aide in a nursing home, And then in states like Pennsylvania, we passed legislation to convert those TNAs, the temporary nurse aides, into full-time CNAs. And we grew our workforce by thousands of people. Let's not try to continue to break through the same brick wall that we always do. Let's be innovative. Let's find those innovative solutions like the temporary nurse aid program. And I think we'll be more successful in the long run.
Yeah, I think that's two really great examples of programs already in place that have been successful and where we need to just find better efficiencies and for replicating
Well,
them.
and that's a great point in terms of efficiencies and regulation.
Right.
We need to cut the red tape.
Absolutely.
We cannot make it difficult or more and more difficult for someone to be a nurse in long-term care.
Absolutely. We need to be cutting out the red tape. Absolutely. But, portability and licensure, portability is a huge topic in long-term care and something that we've been pushing frequently here at Tell Our Stories and something that we're really focused on. So I appreciate your comments on the immigration piece in particular. We've sponsored legislation over the last couple of cycles in Congress that would reallocate unused visas from prior years, and it gets good bipartisan support. And something that I think could be a point of agreement on immigration in Congress where there's not a lot of it. And so hopefully we can be a part of helping to push that narrative forward, because I think ultimately we're going to need what you just mentioned, a coupling of additional folks to actually do the care, but adding innovation and a large role for technology to play as well, and how we can smooth and streamline some of that care coordination.
Yeah, and I would just also add, and it's a bigger picture item, but I think it speaks specifically to the workforce. If we don't change the narrative surrounding long-term care, if we continue to demonize long-term care, if every long-term care story you see across the country is a negative one, I don't think folks in middle school or high school or college are going to look to a career like this. So we really do need to change the narrative at the national level, but in state capitals across the country and in states across the country, to say this is a worthwhile profession, this is a good profession, this is a long-lasting profession, and this is something that you as a young American should look at.
And there's a lot of opportunity for growth, right? It's a growing field with increasing demand that's going to be hotly contested. So we're strongly encouraging any of our younger listeners today, if you're thinking about careers in healthcare, we'd encourage you to check out long-term care communities or other university partnerships that can get you into clinical opportunities and long-term care near you. I couldn't have said it better myself.
I set you up.
You did. I couldn't have said it better myself. And you already answered my question about your message to frontline caregivers. So we're really rolling through here.
Well, and look, another quick message to long-term caregivers. I mean, we're fighting every day for you. And what I always valued at the Pennsylvania Healthcare Association, what I value at Saber today is, if you've got ideas as a frontline caregiver, if there are things that you think need to be fixed within the system, tell us.
Yeah.
Come to us, deliver that message so that we can go fight for you on the Hill. I think that's right.
Absolutely. And share your story at Tell Our Stories. We're always looking for submissions from frontline caregivers who are working with seniors every day. Follow us on our social feeds or tag us. We'll be able to share your story too. You can use our website to submit your own narrative. And I think it's so critical that we have folks who care about senior care and work in senior care sharing their perspective about why they care so much about caring for seniors, because I think that's how we're going to be able to grow the workforce and see the changes that we need to see. Shifting gears a little bit, let's talk on reimbursement, and we talked a little bit about regulation, but let's move to reimbursement and regulation. You've taken on a new role in the last couple of years that put you from the state level to now you're across several states. And I can imagine that environment and the different pay rates and reimbursement rates for providers across different states is probably a challenge to navigate, right? So how has your new role changed your perspective when it comes to reimbursement, and Medicaid rates and Medicare, and there's a component of Medicare Advantage in all of this that we were well familiar with here in senior care, but what has been your biggest takeaways from changing into your new role and operating at a multi-state level provider as opposed to the work you were doing in Pennsylvania?
Okay, so within that one question, I think you asked about 25 different questions.
I left it open.
So I'm going to try to tackle these, but I'm glad we're getting into this. So number one, again, I spent really 15 years learning about one state capital,
right,
one legislative body, one governor, and one series of a congressional delegation to U.S. senators. And now in the last 4 months, I've had to remember all that and now learn about Ohio, Virginia, North Carolina, Delaware, and Indiana. And you're right, it's very different in those states, not just from a legislative standpoint, not just from a gubernatorial standpoint, but from a fiscal standpoint. Some states are doing better than others. And what does that mean for reimbursement? How are we reimbursed? How are we regulated? It's very, very different in every state. One of the things that attracted me to Saber was the focus on quality and quality incentives and quality-driven reimbursement. Not only that, on accountability when it comes to reimbursement. There are many groups within the healthcare space, not just in long-term care. There are many associations that will just say more, more, more. We need more reimbursement. We need more resources. And that's fine. That's all well and good. I believe Saber has a winning message, and I believe we as an industry have a winning message when it comes to quality, when it comes to making reimbursement focused on quality outcomes and quality incentives, when it comes to accountability, holding providers accountable to the care that they provide, and then reimbursing them commensurately for that care. So that's our message in states like Pennsylvania, Ohio, Virginia, North Carolina, Indiana, and Delaware. And I think this is something that can be adopted across the country. We're seeing other states like Florida do it already. Quality-driven reimbursement, quality-driven payments. So that's certainly been a learning curve. But again, it's something that I've been very proud to advocate for, not just in our state capitals, but in Washington, D.C. as well, holding providers accountable and holding everyone to a quality standard.
I think that's a great message because so often the media narrative is focused on really unfortunate but smaller instances of where quality is not what it should be. And what we often say at Tell Our Stories is there are 100 stories a day of great quality care that's being delivered for America's seniors that don't make headlines and don't tend to be clickbaity enough to drive clicks, unfortunately. And so what we're trying to do is elevate those stories and promote the caregiving that happens every day in senior care communities. And I think, you know, based on your experience, you have a long record of experience in senior care and long-term care. What is the side of the story that you wish more people knew about long-term care and senior care communities, or that you felt is not well represented? I mean, is there anything that stands out to you that you wish more people who maybe don't have regular interactions with senior care on a day-to-day basis knew about what happens in communities like in Saber's communities?
Yeah, it really is how much folks care for the residents that they serve, and how those residents, like my grandfather and others, really become a part of the family or an extension of their family to those frontline caregivers. You see how personal it is. You see how tight-knit the community is, and you see how much these residents matter to our frontline caregivers, to our administrators, to our overall staff, whether it's frontline, whether it's dietary, whoever. I wish those stories would get out. And it's one of the reasons why, for instance, a legislative visit to a nursing home is so important. And for our advocates out there, bringing lawmakers, bringing legislators into your facility, showing them around, having them meet the residents, having them meet their caregivers is so important to get that perspective. We don't hear those stories enough. And to your point, we've got to tell our stories and make sure folks understand that.
Yeah, that's great. I think you've hit the nail on the nose in terms of the narrative piece. And I think, you know, we're really proud to partner with organizations like Saber that are doing it the right way and have quality and safety at the forefront of their operations.
Well, and real quick, you mentioned Medicare, and I don't want to miss this point to go back to reimbursement real quick. You know, we're standing in the shadow of the Capitol. We're, 9 months past the signing of the One Big Beautiful Bill. So when it comes to quality reimbursement, we know that folks in the federal government and state capitals across the country are going to have to make difficult decisions.
It's already happening.
It's already happening.
States where you guys operate.
We saw it in North Carolina. We're seeing it in Idaho. We're going to see it across the country. There's going to be a smaller Medicaid pool. So we've got to be smarter about how we advocate for those dollars. And when it comes to Medicare and Medicare Advantage, I mean, I look at Saber's portfolio and I look at our footprint across our 6 states. Our Medicare Advantage rate pales in comparison to our Medicare rate. That's not right. There's got to be guardrails around that to make sure that we can sustain and continue caring for our residents.
Yeah, and there's some bipartisan legislation to help rectify some of those issues in Medicare Advantage that we know have disproportionately impacted long-term care communities. So we are certainly very supportive of some of those changes on the Medicare Advantage side. Let's try and chart a little bit of a vision for the future and look forward a little bit in terms of senior care. If resources were not a barrier, if you have anything that comes to mind as the top improvement you'd like to see possible for senior care communities, resources not a barrier, maybe regulations are not so punitive and draconian as they are today, and we can build a positive foundation from the ground up. I mean, do you have anything that comes to mind in terms of top thing you'd like to see if resources were no issue to improve senior care in the United States?
To improve senior care, if resources were no issue, again, I think we'd have a robust workforce. And there are many steps that we're going to need to take to build that workforce for our aging population as it booms in the years ahead. But to be able to sit back and not worry about how will we staff tomorrow's shift, how will we care for this population in the months or years to come, that would be nice. And I think we can take steps to do it. Again, whether it's legislation here in DC or in state capitals across the country, I think there are ways to build that workforce.
Agreed, 100%. And I think ultimately, our ability to support the additional workforce needs of this sector and in long-term care in general are going to be paramount to our ability to deliver the highest value of senior care possible and the highest quality outcomes as well. Okay, so we're getting ready to wrap up here, and I think ultimately Tell Our Stories is about promoting narratives within senior care, whether it's the caregivers, the folks who are living in senior communities, or the folks who are impacted by them. If you could write tomorrow's headline about senior care, what you'd like to see in 6 months' time, a year from now, what would be a positive headline that you would be happy to see referencing senior care or long-term care communities? Do you have anything that comes to mind?
Yeah.
This is a little bit of a tough question at the end.
Well, that nursing homes are driven by quality. So I'd have to formulate that headline in my mind, but really that quality drives senior care.
Yeah.
And if we can make that's actually a good headline. I'm going to go interview for a newspaper. If quality can drive senior care and not only reimbursement, but the mission that we carry out every single day, I think we all win. Providers, caregivers, and the residents we serve.
Well, I think that's a perfect place to end it. Zach, thanks so much for joining us here at the Tell Our Stories podcast. We really appreciated your perspective today.
Thanks, Ryan.
Thanks for listening to Tell Our Stories. Today's conversation reflects the heart of this podcast, humanizing aging by elevating the voices and the experiences that shape senior care from every angle. I'm so grateful to Zach Shamberg for sharing his perspective with us. It's a good reminder that policy is strongest when it's informed by lived experience. Addressing historic workforce shortages, chronic underfunding, and regulatory misalignment requires the leadership that Zach demonstrated, and it understands that families, providers, and caregivers alike all have a vested interest in seeing outcomes improve for America's seniors. Visit tellourstories.com to share your story and help shape a system that honors those who rely on care and sustains those who provide it. I'm Ryan McNamara, and this is Tell Our Stories, where policy meets people.